When we think of bacteria, most people imagine harmful pathogens that cause disease. Yet, lurking within all of us, right in our digestive tracts, is Escherichia coli. In most cases, this bacterium is a harmless resident of the gut, contributing to digestion and keeping the microbiome balanced. However, under certain circumstances, specific strains of E. coli can turn deadly, causing devastating health issues ranging from severe gastrointestinal distress to kidney failure and life-threatening sepsis. One of the most dangerous varieties, Shiga toxin-producing E. coli, is known for inflicting damage so severe it can leave patients with permanent health issues or even lead to death. Understanding E. coli infections isn't just about knowing which foods to avoid or how to wash your hands correctly. Although both are essential, it's about recognizing how rapidly these infections can escalate from manageable diarrhea to severe complications, especially in vulnerable populations such as children, the elderly, and those with weakened immune systems. In this article, we'll uncover the hidden dangers of E. coli, explore how it spreads, and learn how to protect ourselves from this potentially life-threatening bacterium. If you find this information helpful, please support our channel, Dr. May Sharing Medical Knowledge, by liking, commenting, and subscribing. Your engagement helps us bring you more critical insights and life-saving tips. What is E. coli? E. coli refers to a diverse group of bacteria that naturally inhabit the gastrointestinal tract of humans and animals. The harmless strains are essential for digestion, breaking down food in the intestines and helping the body absorb nutrients. However, when certain strains enter areas they shouldn't, such as the urinary tract or bloodstream, they become harmful. Some strains, like STEC, are particularly dangerous because they release toxins that can attack the intestines, kidneys, and blood vessels. From harmless to hazardous, E. coli infections explained. E. coli infections vary widely in severity. At one end of the spectrum, an infection may cause mild, watery diarrhea. On the other, severe strains like E. coli O157H7 can cause a condition called hemolytic uremic syndrome. HUS results in red blood cell destruction, acute kidney injury, and can be fatal if untreated. Sadly, for some patients, particularly the very young and elderly, recovery from these infections can be long, and the damage to organs may be irreversible. Infections are also not confined to the gut. E. coli can infiltrate the urinary tract, leading to urinary tract infections, which cause discomfort, painful urination, and in severe cases, kidney infections. It can also travel beyond the bladder, triggering bloodstream infections or sepsis, an extremely dangerous immune response that can shut down multiple organs. How dangerous are E. coli infections? The numbers are concerning. In the United States alone, approximately 265,000 cases of STEC infections occur annually, with outbreaks sometimes affecting hundreds at a time. Tragically, between 8% and 35% of people infected with E. coli face life-threatening complications. The most severe infections disproportionately impact newborns, young children, older adults, and anyone with a weakened immune system, such as cancer patients or individuals with HIV. How E. coli spreads, from food to surfaces. Most E. coli infections result from fecal-oral transmission. Bacteria from contaminated feces make their way into food, water, or surfaces and are accidentally ingested. Here's how exposure occurs. Contaminated foods. Undercooked meat, especially ground beef, can harbor E. coli. Leafy greens like lettuce and spinach are also common culprits if washed with contaminated water. Unpasteurized drinks. Raw milk, cider, and juice can carry harmful strains of E. coli. Water sources. Natural water bodies like lakes or rivers can become contaminated from animal or human waste, exposing swimmers or hikers to infections. Direct contact with animals or their environments. Farms, petting zoos, and even handling raw pet food can introduce bacteria into the body. Improper hygiene. Not washing hands thoroughly after using the restroom or changing diapers can spread E. coli, especially within households or care facilities. Signs and symptoms to watch for. The symptoms of E. coli infections vary depending on where the bacteria have taken hold. In gastrointestinal infections, the earliest signs include watery diarrhea, sometimes turning bloody within a day or two, along with cramps, nausea, and low fever. In the urinary tract, symptoms include pelvic pain, frequent urination, and a burning sensation when urinating. For severe cases of STEC, symptoms such as confusion, Fatigue, swelling, and decreased urine output may indicate kidney involvement and the onset of hemolytic uremic syndrome. Without timely medical intervention, HUS can result in kidney failure, blood clots, and death. Complications: when E. coli turns deadly. Complications from E. coli infections are not uncommon. Beyond acute diarrhea, patients may experience sepsis, a life-threatening reaction when the infection spreads to the bloodstream. Children with persistent diarrhea may suffer from malnutrition and stunted growth due to poor nutrient absorption. Pregnant women with infections risk transmitting the bacteria to their newborns during childbirth, sometimes resulting in meningitis, a dangerous infection of the brain lining. One of the most feared complications, hemolytic uremic syndrome, occurs in approximately 5% to 10% of STEC infections. This syndrome can damage the kidneys and require dialysis, with lasting effects on patients' quality of life. How to protect yourself and your family. While E. coli infections are serious, they are also largely preventable with proper precautions. Here's how to reduce your risk. Practice good hygiene. Always wash your hands after using the restroom, handling raw meat, or coming into contact with animals. Cook food thoroughly. Ensure all meat, especially ground beef, reaches a safe internal temperature before consumption. Avoid unpasteurized products. Stick to pasteurized dairy products and juices to avoid potential bacterial contamination. Use separate cutting boards. Prevent cross-contamination by using different boards for meat and produce. Wash fruits and vegetables. Rinse all fresh produce under running water before eating, especially if eaten raw. These small steps go a long way toward protecting you from serious infections. If you're curious about more ways to safeguard your health, don't forget to like, comment, and subscribe to our YouTube channel, Dr. Mai, Sharing Medical Knowledge. Your support enables us to continue spreading critical health information that could save lives. What to do if you get infected. If you develop symptoms of E. coli infection, such as persistent diarrhea, blood in your stool, or a burning sensation while urinating, consult a healthcare provider immediately. Treatment depends on the type of infection. Gastrointestinal infections, particularly those caused by STEC, typically do not require antibiotics, as certain medications can increase the risk of hemolytic uremic syndrome. Supportive care, such as rehydration and monitoring, is often the primary approach. However, infections outside the gut, such as UTIs or bloodstream infections, may require antibiotics, such as ciprofloxacin or nitrofurantoin. Patients with HUS may need specialized care, including blood transfusions and kidney dialysis. Looking ahead, prevention and awareness are key. E. coli infections highlight the delicate balance within our bodies, where bacteria that are typically harmless can turn into deadly pathogens. By taking simple preventive measures, such as practicing good hygiene and cooking food safely, we can significantly reduce our risk. Yet it's also critical to understand when symptoms warrant immediate medical attention to prevent severe outcomes like HUS or sepsis. If this article has been helpful, we encourage you to support us by liking, subscribing, and commenting on Dr. Mai, Sharing Medical Knowledge. Together, we can raise awareness about infections like E. coli and ensure that more people have access to the information they need to stay healthy and safe. E. coli may live quietly inside our bodies, but when things go wrong, the consequences can be severe. Let's take action now, starting with awareness and prevention, because your health is too important to leave to chance.